Alright, so today I'm going to be explaining how I would perform a Foley catheterization. So first I'm going to check the medical record, make sure that there's an order for it. I'm going to review the chart and allergies. I'm going to consider the mental status of the patient. Are they willing to participate? Are they able to participate? Do I need other people to help me? Then I would gather my equipment, make sure I have everything that I need. Then I would enter the room. I'm going to provide for privacy really well, wash my hands, introduce myself to the patient, ask them their name and date of birth, make sure that that is correct with the order in the chart. I would explain the procedure, explain what I'm going to be doing. I would ask them again for allergies. I would make sure that there's good lighting in the room and adjust the bed to working height and then stand on the right side of the bed because I am right-handed. So for females, I would make sure that they're in the dorsal recumbent position with their knees up, just easier for the catheter to go in. For males, I'd have them lie flat with their legs kind of spread apart so that I have more room. Then I would go ahead and put clean gloves on, and for females, I would use a washcloth, wash one side of the labia, top to bottom, or top down, change the corner of the washcloth, wash another side of the labia, top down, and then change the corner of the washcloth again and wash down the middle. For males, I would clean the tip of the penis in a circular motion from the meatus out and then wash down the shaft. And then I would take my gloves off and perform hand hygiene again. And then I would get out my catheter package. I would open it sterilely. I would put the sterile drapes under the patient first, holding only the outer 1 inch so that I make sure not to touch it. If I do touch it, I'd have to get a new package. Put the sterile drapes underneath of them just to make my sterile field a little bit bigger. So then I'm going to put on my sterile gloves, and then once I have those on, I can place the fenestrated drapes over the patient on their thighs. Then I would pick up the kit and move it to the bed. I would open all of the supplies in the kit, making sure that everything's ready to use. Open the swabs, open the lubricant, dump that in, attach the syringe to the balloon port, and remove the Foley catheter from its packaging. Then I would tell my patient that they are going to feel my touch and just ask them to just take a few deep breaths throughout the entire procedure. So for females, I'm going to use my non-dominant hand to spread the labia and identify the meatus. I would note that I wouldn't take my hand off of that until the catheter is in. So then I'm going to use my dominant hand to clean from top to bottom with one swab, one side of the labia from top to bottom with one swab, discard that swab, grab another one, scrub from top to bottom on the other side of the labia, discard that, and then top to bottom down the meatus and discard that. Then with my dominant hand, I'm going to place the drainage end of the catheter into the receptacle if I need to, or attach it to the bag, make sure that the clamp is closed. And then I would grab the catheter with my dominant hand, hold the catheter 2 to 3 inches away from the tip, and dip it in the lubricant, make sure that's good. Then I would insert it into the urethra and advance it slowly until I see urine return in the bag. And then once I see the urine return, I'm going to insert it 2 to 3 more inches so that I know that for sure it's in the bladder and not just in the urethra. So then for males, I would start by lifting the penis with my non-dominant hand, retract the foreskin. I would keep my hand there until the catheter is in, and I would pick up the swab with my dominant hand, clean in a circular motion from the meatus out, down the shaft, get rid of that, and then do that 2 more times so that we make sure that's clean. Then I'm going to hold the penis slightly upward and perpendicular to the body. I'm going to pick up the catheter with my dominant hand, and I'm going to ask the patient to bear down as if they were voiding. Then I'm going to insert the tip into the meatus and ask the patient to take a few deep breaths, and I would insert until I hit the bifurcation. So then once they're both in, I would hold the catheter securely at the meatus with the non-dominant hand. I would use the dominant hand to inflate the syringe, or inflate the balloon with the syringe. And for males, then I would replace the foreskin, or retract the foreskin, and lower the penis. I would pull gently on the catheter for both male and female to make sure that I feel resistance. And then I would get rid of all my equipment, discard anything properly, and then I'm going to secure the catheter to the patient's inner thigh, and making sure that there's enough room for the whole leg to move around in all ways. And then I would just assist the patient to a comfortable position and secure the drainage bag below the level of the bladder, somewhere under the bed, not usually not on the floor, making sure that the tubes aren't on the floor, but that it's also not in the way of anything. And then I'm going to document.